So we are here. We have our less than 24-hour-old baby, and really just wanted to sit down briefly and talk about what are the key things for the first 24, 25 hours of your baby's life that are going to give you guys that good start to your baby's newborn life.
Yes. And if this is your first baby, I always find it so helpful if I know what to expect. So
yeah. And of course, there's so many variables in this first day. And so if your day isn't perfect, that's okay. There's so many things that can go haywire. That's okay.
That's why you're in the hospital.
But we just want to take a couple minutes to talk about the basics, just in case it's your first time meeting us. I'm Kurt. I'm a board-certified pediatrician.
I'm Sarah. I'm a board-certified OBGYN.
And we are the doctors Bjorkman. So what are the key things about your baby's first day of life starting out? And from the get-go, one of the things that part of kind of established practice in baby-friendly hospitals here in the US is that baby is on mom's chest as soon as possible. Really a major goal for this first day is just bonding with the parents, with mom, with dad, with partner, etc. And some of that starts right out the get-go, skin to skin time.
A baby's kind of goals are eat, sleep, pee, and poop before you can go home.
Yep, and so much of that really resolves around bonding.
Yep.
And so baby gets delivered, goes to mom's chest. And if you're thinking about breastfeeding, this is a great time to, baby's gonna be looking around for that nipple and starting that process out right, because, mom's milk supply is not really gonna be a large volume in that first day. It's really just that thick colostrum that's got all those special antibodies and special fats.
Yes.
And part of helping mom's supply come in is just lots of time with baby at the breast, suckling, stimulating all of those hormones that lead to milk production for mom.
So important things that you're looking for are feeding cues. If you're breastfeeding, one of the important things is feeding on demand. So what does that mean? It means you are looking for feeding cues that say, hey, baby is hungry.
Yep. And so this could be as simple as lip smacking, tongue thrusting,
rooting around. Those are kind of early signs.
Yeah. And then as baby is maybe getting more hungry, then you're going to get to more of that crying, etc.
Yep, they start getting a little more active. And then when they are crying, fussy, they're saying, feed me, soothe me.
And it's going to surprise you how much time they want to spend at the breast. They may feed 15, 18, 20 times during that first day. And really it's all just baby saying, hey, I'm ready to eat, and really working on getting mom's supply to come in.
Yep, it's this wonderful feedback loop between boob and brain of baby saying, I need more milk. Brain is going to work on bringing that milk in, which takes anywhere from 3 to 5 days.
Yep. And the amazing thing is baby comes out with stores on board, so they're not starving. They don't need that extra calories, but it's really just about getting that process started, which is where that skin to skin time starts that process off so well right off the bat.
And their bellies are so little. They don't need a lot. A few drops of colostrum as they're doing this cluster feeding is, again, liquid gold.
We say the stomach is probably about the size of the last digit of your pinky that first day. And it's really going to grow a lot over this first week of life as they start to eat more. And as that feeding process goes, it really gets to all of those other things. Baby needs to pee and poop, really starting to mobilize all of that stuff that's been in their gut, getting out that thick black meconium. And that's actually going to help prevent them from getting jaundice, bilirubin, high levels of bilirubin, because they're going to poop out that bilirubin to keep them from getting overly jaundiced. Well, middle of the inaugural night here with baby Hank, and so I take this opportunity to show you guys what meconium is, or that first dark tarry stool bowel movement from your baby. Here you can see it's this dark brown, black colored, thick, just gunk. Which is particularly challenging if it sits in the diaper for any period of time, because it just then dries out and gets really hard to clean off, especially boy parts where there's lots of grooves and crevices. So if you can catch it pretty soon, it just helps get that baby butt clean easier. But otherwise, maybe you go through 10 or 12 wipes to get that butt clean. The other pro tip is a little Vaseline on their butt when it's clean. Makes this cleanup a lot easier, because then it just kind of comes off. rather than sticking to all those grooves and crevices in the skin. Anyway, good luck cleaning those diapers out there. Of course, peeing is an important step in this, making sure all the systems are online and working.
And they sleep so much.
They
don't have a circadian rhythm really until 8 to 12 weeks or so. And so there is a lot of helping them learn that.
Yes,
things
and so
we think about are, you're trying to help your baby learn day from night in the coming weeks. And so
this morning at 8 o'clock, the sun came up, we opened the windows, like really starting to show them daylight in the daytime and nighttime at the nighttime. Of course, they're going to feed around the clock this first day.
Yes.
But a little bit more, the sooner you can get them used to, like, it's light out now and it's dark now.
Yes. And especially in those early days, thinking about, trying to feed them, to put them to the boob every 2 to 3 hours, especially during the day, because again, you want to, A, they need to eat, B, fill their little tanks during the day. And so then if you get a longer stretch of night, cheers. But it takes them some time.
The final thing about this first 24, 25 hours is making sure baby is safe and well. And so this is going to come in a couple different stages. The first is right out the gate. The OBGYN, the midwife, whoever's delivering your baby is going to look at the baby, make sure they've got a good strong cry. Their color is changing appropriately. That first exam, making sure baby is doing all the normal baby things, breathing comfortably, etc. Throughout the first day of life, the nurse checks in to check on vital signs, all of those things again, easy breathing, heart rate appropriate, etc. Now you're going to notice all sorts of things. There's going to be periods where they have these little periodic fast breathing that's really normal. Our little guy had a bunch of spit up and was like really working on mobilizing some of this fluid after he was born. Some spit ups are pretty normal too, some sneezing. Maybe you'll notice your baby is hiccuping. Maybe they're doing a lot of little grunting in their sleep. There's a lot of normal signs and cues that you'll see in the first 24 hours. Here in the US though, then that hour 24 is kind of that last kind of big check for us before we go home, doing some final screenings. This takes a couple places. So the hearing screening happens in this first day, making sure that their hearing is appropriate. Definitely kiddos are at risk for CMV, which can cause hearing deficits. They get a heart screen as well. This for us is taking the oxygen saturation in the right arm and then one of the legs to make sure that the saturation is overall good and that there isn't a big difference between the arm and the leg that could be a sign of certain congenital heart defects. And then the final thing is that bilirubin level check to say, hey, do they have really high levels of bilirubin, high jaundice that could be potentially a risk for them and their little brains? And the best way to prevent this is lots of feeding, because you get rid of that bilirubin with poop and with light exposure also through the P2.
Yes, and the final thing that they do around the 24-hour mark is the newborn screen. This varies from state to state how many conditions they screen for, but it's usually a heel stick.
Usually in around about 50 different genetic conditions or other conditions that can be detected by this screen, that if you catch it early can make a big difference in outcome of your baby. And so they get one little blood spot that they send off to the state that they test for all of these treatable conditions that can make a big difference in your baby's life. And usually those results come back in the first week of life. Your pediatrician is going to follow up on that first visit.
Yes.
So
they usually will make sure you have a pediatrician appointment before you go home. That's like on their checklist to make sure, there's a lot of support at the hospital. There's nurses checking on you all the time. There's lactation consultants if you need it, and would highly recommend having them come check out your latch, talk about pumping, anything. Use those resources while you're at the hospital. And then they want to make sure you're set up for support when you go home. When are you going to see your pediatrician? Usually they want you to see you within a couple days of going home, so baby can go for a little weight check and somebody can check in on you.
And make sure all those things are going well for mom too. And so with that, this is all the big things for baby in this just first day of life. We're going to talk about all the things for mom in another episode too, so make sure you guys check that out. We're doctors.
But not your doctors.
Anything we've said in this video is for education or entertainment purposes only.
It is not medical advice.
Any specific medical questions you have should be directed to your provider.